Hello, we're now continuing with Chapter 10, starting on our second of our two sections. We'll be talking about emotion, temperament, and the DSM-5. Now, this is a pretty good definition of emotion. It incorporates three facets: the feeling, the physical response, and the overt behavior that is exhibited. Emotional regulation is seriously important. Like many areas of development, we get better with age at managing our emotional responses. Individuals with poor emotional regulation are often unpredictable, and most of us don't like to be around them. One thing that helps with developing emotional regulation is social referencing. This involves looking to others to know how to respond. If everyone is remaining calm, or if they're freaking out, we especially look to people we admire and trust, and we model their behavior. Temperament is different from emotion. Emotion is transitory, fleeting, it's a state. Temperament is abiding, it's a trait. It typically does not change over a person's lifetime. Generally, there are three temperamental types. The easy child will display mild emotional intensity. They are accepting of new experiences, but will be circumspect in approaching and responding to novel stimuli. They will be regular in their habits, sleeping, eating, bowel movements. Now, the difficult, and this is an unfortunate label, the difficult child is often emotionally intense. Everything is a crisis. They are inconsequential, irregular in their habits, and unreceptive, sometimes aggressively so, of new experiences. The slow-to-warm-up child often displays a generally dissatisfied, even negative mood. They are very uncomfortable with environmental and routine changes. They can be whiny and anxious. They're prone to worrying. Now, there was a longitudinal study. Remember that? It's a long time, same group of individuals. It was conducted on temperament by Dr. Roy Martin. He began with neonates. He placed a large, cool rubber disc in their bassinets at the hospital. The infants tended to fall into one of three groups. There were those that screamed and screamed their discomfort, displeasure, often until someone couldn't take it anymore and removed the disc. Those were the difficult children. Another group whimpered and whined, obviously uncomfortable, but there was no other action. Slow to warm up. Oh, everyone's favorite group, though, that was those neonates who would appear disgruntled, but then slowly shift themselves away from the disc and then drop off to sleep. Dr. Martin followed these three groups. In preschool, there were those who were having temper tantrums, some with aggressive outbursts, the difficult ones. Those who would cry and whine when things didn't go their way, rather than expressing the problem or trying to resolve problems, slow to warm up. And finally, there were those who would color their sky green, because Jackson was holding on to all the blue crayons, and 100 years from now, who will know the difference anyway? Easy. These behavioral traits persisted up through adulthood. Dr. Martin did lose a number of those in the difficult group during adolescence. They had higher rates of suicide, being victims of homicide, criminal behaviors, running away, heavy-duty drug use, etc. He also lost track of those in the easy group. If they moved, they might not remember to let him know of their current whereabouts. He did keep up with the slow-to-warm-up group. They tended to obsess over details and would always remember to let him know where they were. One last interesting detail. While the difficult group did have the heaviest drug use, they often began young and they often used high-powered illegal drugs. The easy group also dabbled. They tended to be older adolescents, even young adults. They reported occasional use of recreational drugs. The slow-to-warm-up group had the lowest drug use, usually reporting little to no drug use. Now, labeling a child as difficult is not something anyone would recommend. Sometimes we'll refer to these individuals as high maintenance. But despite their sometimes grim outlook, not all difficult children end up dead or in jail. There are some pluses to being on this end of the spectrum. Because they aren't regular with their habits, they can help the rest of us pull an all-nighter when we need to. Their emotional intensity can be channeled into correcting social injustices. They are our fiercest friends, although they're not always the easiest people to be around. Where we see problems are in settings in which there is poor goodness of fit, where caretakers, parents, and teachers may not respect the temperamental characteristics of the child. Now, it's not always the case that you have a highly regulated parent despairing of their high maintenance irregular child, which is what we usually think of. You can also have an irregular parent with a regulated and often disgusted child. Mom, you're picking me up in pajamas again. Our next topic is the DSM-5. These are the official guidelines for diagnosing mental health disorders. This is a picture and a description of the latest edition from 2013. I will tell you that some of us are having difficulties with this newer manual. Okay, it's based on the medical model. Problem behaviors, irrational thinking, or diseases. It's not always neat and tidy when you're trying to move toward a definitive diagnosis, and it doesn't provide any treatment recommendations as to what's the best practice. The primary criticism of DSM-5 is that it pathologizes a number of behaviors which many of us would consider normal, including temper tantrums in a 2-year-old, and grieving and sadness following the death of someone close to us. I want to talk about 2 of the classifications that are in DSM. Depression. It is considered a very serious disorder. Nearly 1 in 6 Americans will experience major depression at some point in their lives. 10 to 25% of women will experience depression. Now, this is what makes depression so concerning. About 2/3 of depressed individuals will exhibit suicidal ideation. Somewhere between 10 to 15% will die by suicide. Depression is a lethal disorder. It's also associated with a variety of health complaints, including joint pain, headaches, backaches, abdominal pain. There's an increased risk of myocardial infarction, and there's decreased bone density. Now, by far the most common mental health complaint, anxiety. Probably just about everyone experiences anxiety to some degree. It manifests as persistent worrying. It can range from crippling agoraphobia, where everything is frightening and overwhelming, to very specific phobias or just generalized worrying. It's often accompanied by physical complaints like panic attacks, nausea, heart palpitations. Now, aside from medication intervention and exercise, which are both helpful, there is at least one other very good intervention, which we'll address in the upcoming chapter on personality. This is the end of Chapter 10. Next is Chapter 11, Personality.